Good afternoon, ladies and gentlemen. Very happy to have you here, the 38th Annual Cancer Control Society Convention, Universal City, Sheraton Universal Hotel. Our next speaker is Dr. James Privitera, medical doctor, pioneer, incredible physician. He's another one that actually was sent to jail for practicing medicine. It's been a few years. It's another story, interesting tale, and sometime we have more time, we'll go into it.
We both had brown hair.
Yes.
In those days.
Over the years,
Schachter did too.
Over the years, he's done so much for us and so much for his patients. What he's going to talk today about is a topic that's extremely important. It has to do with inflammation. And with all of his experience, he's very well qualified to talk about it. So, Dr. Privitera, thank you very much for being here.
Thank you. Are you using that at all? I'm going to use this. Okay. Yes, it's been a long time because I couldn't be here last year, so I was here 3 years ago speaking. So we're going to talk about one of the most important things, as you see some of the slides. And unfortunately, there's a word inflammation. If you ask 10 people, even medical people, what it is, you're going to get kind of 10 different answers, okay? But I'm going to tell you one thing, that clotting is at the heart of inflammation. And that's not good, okay? So you don't want to be clotting excessively. You want to be clot if you're cut. You want to, and so nature is all about balance. Okay, so we're going to go ahead here and talk about this subject. I'm hitting the forward here, and it's not moving. Okay. See? Oh, to the right, not forward. Okay. So these are many things here that can cause excess clotting. Okay, sugar, caffeine, alcohol, fat. Now, the toxins in fat, okay, or estrogen in fat. So don't eat American beef with hormones in it if you possibly can avoid it. And toxins and blah, blah, blah will go down and catch these later. All right, that's what a clot looks like on a dark field. Even though these are microscopic, you're going to see from the later slides that our tests show that these are significant. So if you know a doctor who does dark field microscopy like Dr. Schachter, they don't let them do, oh my God, I hate to hear that. That's like saying that you're taking away a shovel from a ditch digger, you know. You can't use a shovel. You're a ditch digger. It's too bad. Well, that's what's happening. And Dr. Schachter's from New York, and he tells me you can't use a dark field microscope in New York anymore. We can't use adrenocortical injection shots anymore that used to be fabulous for people, especially with chronic fatigue and hypoglycemia. We don't have, it's unavailable. We can't get adrenocortical extract shots anymore. Okay. So this is, we're getting tyranny by the numbers. So basically, we have a clotting epidemic. And the reason it's an epidemic, Dr. Martin, back there, he suggested, Dr. John Martin, CDC fame, FDA fame, he suggested that we check 100 people. I said, well, we see clotting so often. He says, how many? I said, I don't know, frequently. So we did 100 random charts, and we found 1 out of 3 people with excess clotting, and that's 4 times the size of a red cell, extremely high amount. And so to verify the findings, we took 22 patients, and with the large clots, 4 times the size of a red cell, and we did highly sensitive C-reactive protein tests on these people, and we found over greater than a 95% correlation. And that's extremely high. So if you don't have the availability of dark field, if your doctor doesn't do it, at least do 2 things. Have him do a ferritin, F-E-R-R-I-T-I-N, and have him do a highly sensitive C-reactive protein. These are very important tests. Okay, well, this is just to show you kind of what it looks diagrammatically, a vessel with a clot in it, and what a platelet is about maybe 1/4 the size of a red cell, so they're quite small. And this is a recent slide from '09. This study, it was a combination of studies, is you want to almost read this word for word, okay? Bottom line is the thromboembolic events in patients are often the first clinical manifestation of an undiagnosed malignancy, okay? So clotting, old studies from 1986 in Lancet showed 80% of people with metastatic cancer had excess clotting, and 1 out of 2 people with cancer had excess clotting. But now they're saying that antithrombotic therapy can extend the survival in patients with cancer by a mechanism that extends beyond its effect in preventing vein clots. And accumulated evidence from in vivo and in vivo studies has shown that tumor growth, invasion, and metastasis are governed in part by elements of the coagulation system. In other words, ask your doctor if you have cancer or think you have cancer to test you for excess clotting. And if he doesn't know what that means, have him do an HSCRP or a highly sensitive C-reactive protein. Okay, so this is kind of funny because saturated fat in these studies was shown to increase HDL. Now I'm going to assume that the saturated fat here we're talking about has no excess estrogen in it, so it's not American beef, because estrogen itself promotes excess clotting. That's why a lot of women who have PMS have what? Have headaches before period, and the headaches are due to clotting. And so it's very interesting. And so 4 ounces of beef, not processed, okay, can increase the risk of heart disease. All right. No increase in risk of heart disease. Sorry. Okay. So sugar, a little over 4 ounces a day, is a major reason for excess clotting. Okay, so every time you have a teaspoon of sugar, maybe you ought to pop another fish oil or something similar. Similar would be like nattokinase or bromelain or turmeric or garlic oil or feverfew. There's a whole bunch of, and they're usually pretty cheap. And usually every ethnic group seems to have one substance that is an anti-clotting material. And of course, pollution. So pollution increases cardiovascular disease. So if it increases cardiovascular disease, it has to increase clotting. Okay? So if you're around a lot of pollution, besides detoxification, then you also want to keep the blood thin. Very important. Because so Americans, at least Americans, that's who I test, their blood is generally too thick. Okay? So you don't want thick blood because it blocks oxygenation and other organs like that. This is a devastating study. And unfortunately, it's hardly mentioned by the establishment doctors. Are needle biopsies safe? And the answer to that is no. Okay? How many people knew that? Okay, I'm getting like maybe a fourth. Okay? The reason they're not safe is because 50% of the time, and it doesn't matter how you do it, if you biopsy a tumor, if you hit the cancer, you're going to cause up to a 50% of the time you're going to cause a spread. This study is just one that was in '04, and this is in at John Wayne Hospital here in L.A., in over 663 women with breast cancer. We picked the breast cancer one because it's more common. So, this is really amazing. Okay? You would think this would have been in the front page of the paper. Never happened. Okay? And this is the kind of answers you get. Doctor, I've had patients do this. I'll make a copy of the study, give it to the patient bring it in, and here's the answer you get from the doctor. Well, doctor, I don't want to do a biopsy because look at this study. Oh, yes, I know. But it's protocol. Well, doctor, but it causes a spread of cancer. Well, yeah, but it's protocol to do the biopsy. So I had a particular patient, I'm going to tell you the story of what happened. So this patient goes in, fights with the doctor. I say, get him to do an excisional biopsy, meaning taking out the whole tumor, but not actually penetrating the tumor. Just do a wide margin, an excisional biopsy. So she talks him into doing that, and she's got cancer, but the margins are clear. So then he says, well, now what I want you to do, take 20 to 30%. There's a 20-30% chance that it spread to the nodes under the arm, so I want to do an axillary dissection, take all the nodes under the arm out. And so she calls me up again. Now what do I do, Dr. Privitera? I said, well, the next thing you do is ask them for a PET scan. How many people know what a PET scan is? Oh, good. Maybe 2/3. Okay, PET scan is where they use sugar because cancer loves to eat two things, sugar and iron. And inject radioactive sugar, okay, and you get about a half a centimeter is the tolerance. You can tell whether there's cancer because it's going to light up. Cancer's going to light up. So he wouldn't write for the PET scan, so I wrote for it, okay? And so she had the PET scan, it was normal. He says, no, we still should take the nodes out. So she went a couple of years and no problems. But she would have had all those nodes out, which represents about 10% of your immune system. So the PET scan helped prevent the removal of all those lymph nodes. Okay, and then there's other cases like this. Just recently, a lady who was 78, 79, she had an x-ray, her CAT scan showed some possible tumors in her colon, and she was going to have a major surgery. And I said, wait a minute, why don't you do a PET scan? She did a PET scan, negative, okay? So she never did anything. So the PET scan, which cost her $2,000, cost her. They wouldn't pay for it. The surgery would have been probably $10,000, but the PET scan, they didn't suggest, and they won't pay for it. I told her to take them to small claims court. Anyway. So this is also a devastatingly amazing. This was from the LA Times, and really every word is awesome. Men with prostate cancer often take drugs to stop the body's production of testosterone. It's called testosterone blockade, the hormone that feeds initial tumors. But when these cells die, they trigger an inflammatory response. Here we go with inflammatory again. That paves the way for the growth of deadlier prostate cancer cells that are resistant to the hormone therapy. Incredible. So, and this, again, the American Cancer Society, they're now saying that tumors found, prostate tumors, are inconsequential and that biopsies and treatment produce more harm than those tumors would. So there is so much controversy at this point in time, it's incredible. Okay, so I like PSA tests. If you have somebody who has prostate cancer, I think it's a great way to follow the prostate cancer. But you get this kind of stuff out there, and it's amazing the kind of contradictory stuff in research in America on common diseases like prostate cancer. Now I'm going to switch subjects here a little bit. I've seen a lot of what are called Gulf War syndrome patients, okay? And this is a typical one with a high uranium,